Hi, I'm Lindsay.
And I'm Paige. Lindsay and I were both in acute care settings for our most recent clinical experiences. On our rotations, we both encountered many patients with strokes, so we decided to search for interventions to help patients with acute strokes regain motor control in their involved limbs. We found an article by Lee, Cho, and Song, which looked at mirror therapy program and how it enhances upper limb motor recovery and motor function in acute stroke patients. We chose this article because we both recognize that this intervention is used for people who have had amputations or joint replacements, and we were interested in what kind of effect this may have on patients who have had a stroke. We formulated our PICO statement, and our P represented people with acute stroke. Our I is mirror therapy. C is standard rehabilitation only. O is motor function, which we determined is a primary outcome, and our S is a randomized control trial. Mirror therapy focuses on the movement of contralateral limbs and performing movements of the unaffected limb while watching its reflection in the mirror. This creates an illusion of enhanced movement capability in the involved limb. The mirror neuron system can activate motor processes when the reflected hand's movement are observed and can even trigger the unseen hand behind the mirror to move. Previous studies on mirror therapy programs are used for phantom limb pain after amputation, and they have become the foundation on neuroplasticity of the peripheral and central nervous system. Since then, mirror therapy has been applied to treatment of stroke, peripheral nerve system injury, and coordination disorders. We included 26 men and women from an inpatient stroke rehab hospital based on 3 criteria. The first one was that the patients had to be diagnosed with an acute stroke within 6 months of the start of the study. And the second was that the patients were able to follow and understand simple directions. And the last one was that they had a Brunstrom score between 1 and 4 of their upper extremities. The control and experimental groups were split evenly, 13 people in each group, and both groups received standard rehab, including therapeutic exercises, occupational therapy, and functional electric stim 5 times a week for 4 weeks. The experimental group received all those things along with the mirror therapy program for 25 minutes twice a day for 5 days a week for the 4 weeks also. This included placing the uninvolved limb in front of the mirror and having the patient observe the limb and perform 10 movements from proximal to distal joints of the upper extremity. Outcome measures were used to assess upper extremity motor function and recovery, and they used the manual function test to assess motor function and the Fugel-Meyer assessment and Brunstrom stages to assess motor recovery.
Yeah, so as Paige said, the outcome measures that they used were the upper extremity portion of the Fugel-Meyer assessment, which has 5 items for the wrist, 7 for the hand, and 3 for upper extremity coordination, assessing motor recovery mainly, and then the Brunstrom stages for upper limb and hand, and then the manual function test to assess upper extremity motor function. When we looked at the results, it was clear that overall both groups showed improvements. It's important to reiterate that the participants in both groups had no significant differences in the Fugel-Meyer or Brunstroms before treatment. After treatment, both groups showed significant improvement in the upper extremity portion of the Fugel-Meyer, but the group using mirrors showed more improvement. For coordination and Brunstrom scores, however, both groups showed improvement, but there was no significant between-group differences. Similarly, after therapeutic exercise and their interventions, both groups improved in Brunstrom score and motor function, with the experimental group using the mirrors showing significantly more improvement. So overall, it shows that there was improvement in both groups, but significantly more improvement in the group with the mirrors. These results show that the mirror therapy is a viable and relevant option for this patient population. In light of these results, we decided that mirror therapy is relevant and useful in current clinical practice. The patient population that they used in this study is similar to those found in inpatient rehab settings in the US, and mirrors are cheap and easy to access. The exercises are easy to incorporate into the therapy that's already given to this patient population. However, we feel it is absolutely imperative to point out that It is just an adjunct to the already standard rehab. So overall, this article shows that the use of mirror therapy in conjunction with standard rehab with this patient population, those post-stroke, is a beneficial intervention for recovery of motor function in the upper extremity. Therapists should be encouraged to use this strategy as an adjunct to their therapy with this patient population. Thank you. Access and the patient. Oh God. And how did her hand get up there? I already said that part.
Yep.
Okay.
God, we were so good.
I was ready. We should
I know, I'm
incorporate a
sorry.
bloopers reel.
That would be hilarious.
Thank you.